All right, so welcome to my myofascial releasing video. That's a big word. What does that mean? So basically what happens to all of us when we're working out, or whether we're not, we're sitting more, or whether we're young or whether we're old, is that just through everyday life, we get what's called little microscopic tears in our muscle fibers. And then those little microscopic tears heal by bunching up, and they actually get thrown off the grid, the matrix of a smooth firing muscle fiber. So it's like a bunch up, and it's a sore spot or a knot, sometimes people call it. And if you're not doing something to release those, then let's say you start doing a workout and then you stretch or you do a movement with a weight, that little bundle, it would be like taking a rubber band and tying a knot in the middle and pulling from each end. That knot gets tighter, and then that tighter knot is less elastic, and then the fiber around it when you're doing your workout is actually ripping, and it can lead to bigger injuries, anything from a muscle strain and pull to just tendonitis and sore muscles that are not necessary. So the foam rollers are one device that are used for myofascial release, and basically it's like having your own massage therapist but you're doing it yourself in the convenience of your home. And the other thing for the myofascial releasing is that, unlike with a massage therapist that you might go to once a week or once a month, we're moving and getting these fibrosing 24/7. And so on some sort of regular daily basis, we need to be doing a counterbalance for that. Get the knots out, get the myofascial fibers released into their firing matrix. And so I suggest to my clients that we do some sort of a myofascial release routine daily. And I like to use the word hygiene, because hygiene implies, just like brushing your teeth and taking a shower, that you do it on a daily basis. So whether you're somebody who's very active, who is very not active, both those scenarios lead to tightening muscles and fibrosing. And so this technique, this routine that I'm going to show you right now, is something that you can follow. You just have to get a foam roller and a tennis ball. I'm going to be using these two props. There are many other devices that you can use for self-massage, but I want to cover the basics here, simple, and show you a routine that you can do. Literally, get out of bed with your alarm, onto the floor next to your bed, 5 minutes in the morning, and now you've done this for the day. You don't have to do it right before your workout. You just have to have done it sometime before a workout, and even on a day that you're not working out, just to maintain fluid muscle firing. So I'm going to go through the routine with you. You can follow along, and I'll be explaining things as we go. So you start by sitting on your foam roller, and just so you know, the foam rollers come in various hardnesses. So this one that I have is a generic first generation. It's a foam. It's the styrofoam. It's hard, but there are others that have different fillers. There's some that have textured outsides. So not one is not better than the other. It depends on you. If you're an athlete with really hard taut muscles, you might want to get the more firm ones. If you're somebody who's more sedentary and sensitive, it might be that you want something more of this kind of a fiber. So just know that there's a variation out there. So I'm using this one. You can use one similar. So you're going to start by sitting on it, and then we're going to start with the lower back. So you put your hands on the floor behind you, and then you're going to roll onto your lower back. And then once you're there, you're going to go, you're kind of like vibrating or going back and forth. You don't just stay in one position. You're going to take 20 seconds on each body part, and you're actually, rubbing it, massaging it, rolling on it. So you're not staying in one position. And what you will find is that you find what I call hot spots. So there are places that are very sore or very sensitive, and they'll hurt. So you can actually lift yourself up on your arms to take some of the weight off the body part on the roller, or go heavier, by not using your arms at all. But on these myofascial release things, the pain you're feeling is not a bad pain. It's actually helping to break things up. So don't be afraid. Sometimes clients ask, like, this hurts, should I be doing this? If it's an acute injury with a bruise, no. But if it's muscle tightness and soreness and these fibrosing, then yes. Spend a little extra time on that one site and take as much pressure as you can handle. All right, so now from the lower back, you're going to come back on top, sitting. You're going to cross your right leg over your left knee, at the ankle and knee, and then you're going to roll onto the hip, onto the glute, like if you had a dimple in your butt cheek, that's the point you're on right now. Sometimes it helps to take the opposite hand off the floor and put it on your shin, and then you're rolling right in, like I said, the dimple of your butt cheek. And usually people are sore there. This usually is a spot you're like, whoa. So again, you want to do what I'm doing, rolling back and forth, like kind of massaging, breaking up these fibers that are thickened, and then smoothing them out so they're in a nice smooth matrix. All right, from the butt cheek, then you're going to straighten out the leg that was crossed and roll the top leg over, keeping the bottom leg straight. You take the hand to the front and you come down on your elbow. And now we're going to go up the ITB band, the side of your thigh. You kind of crab walk your elbow and hand, coming up and down the length of your thigh from the knee right up to the hip. And usually, for me right now, right here is a hot spot. So I'm going to stay on that. I'm going to roll it out. I'm going to try and break up that fiber, get it more smooth. And let me tell you something, this hurts right now. But again, it's a good hurt, if you will. And the more you do this on a daily basis, the more you'll notice that these hot spots become fewer and far between. All right, from the IT band, you're going to roll so that the roller is ending at your groin. And now you come down onto your elbows. And the front of your hip, the hip crease is right in the roller. And again, right now I feel a spot right here. It's actually a sore spot, so I'm going to spend a little bit of 20 seconds rolling up and down on that spot, trying to break it up. But then you're also going to crab walk up, and you're going to roll up the meaty part of your thigh, trying to find spots that might be, hot spots and staying on them. You can angle yourself a little bit to the side to get the lateral or the outside quads. You can angle yourself into the center, so you're getting the middle rectus femoris. And then, once you're done with that, you're going to now roll off the roller, take the top leg that you just were rolling, turn your roller on a 45-degree angle and come down onto so you're supporting your head, so you're lower. And now we're going to get the inside quadricep, the VMO, which is usually sore on people because it's a weaker of the four that are in the front thigh. And you're going to straighten your leg and you're going to roll into, it's the inside lower part of the thigh as it attaches into the knee. And like I said, many times this is an area that a lot of clients are sore and don't even know it. So now we just went around the whole leg, hitting all the major muscle groups, and the glutes and the lower back, and then you're going to come back on top and repeat on the other side. I'm going to move myself down a little bit, because otherwise I'm going to end up in the weights, and that happens a lot. You'll be traveling with the roller, so you might have to reposition yourself. So now we do the same thing on the other side, crossing at the knee, rolling onto the butt cheek, and then finding that there's usually a sore spot right here. So you're getting right. These are the deep piriformis muscles and others that a lot of runners and athletes have problems with, and this is going to help be preventative for injury as well as enhance your athletic pursuits as well. Right, so now just like on the other side, we straighten the leg, take the top leg over, come down to the elbow, and then crawl like a crab up so I can go up and down the length of this outer hip and thigh. And again, right here for me is a hot spot, so I'm going to stay on that. You find your hot spots and stay on those. 20 seconds minimum. If you can take more, good. But you got to take at least 20 seconds. I usually count 1, 2, 3, 4, 20 seconds that way, or watch a sweep second hand clock. All right, now we're going to come to the front, so I'm going to roll the end of the roller right into the groin, and then come down on both elbows, and then right in the hip crease is the first place. And again, I have some soreness right here, so I'm going to spend about 20 seconds on this. Just trying to break it up. I can add more, I can take some pressure off by putting more weight in my arms, or I can come down heavier so there's more weight. So you can control how much pressure you're using. If it's too much pain, you can't take it, lighten it up by putting more weight in your arms. All right, now I'm going to climb up and get into the front of the thigh. Okay, I don't have anything going on right there. I'm going to angle a little bit to the side. Okay, I've got a little bit of stuff going here on the lateral side, so I'm going to stay on this for about 20 seconds. And then again, I'm going to then go off the roller, onto the side, come down to support my head, turn it on a 45-degree angle, put the inside quad right above the knee, and then turn my whole body using the weight of my body to go into this to roll out the inside quad, which is the only one we haven't hit. in the lower body. So hitting that 20 seconds. And then back on top of the roller. So actually off the roller now, because now I find the roller is very good for the big muscles of the lower body. Another area that I have to use, help people release, is the shoulder blade area, the middle of the shoulder blades and the top of the shoulder and the neck area. And I don't find the rollers too thick and too big to hit these areas, which are smaller. And this is where I like to use a tennis ball. Right? So what you do with the tennis ball is you put it on the floor, and then you're going to take your body and you're going to place your body so that the tennis ball hits right inside the edge of the flat scapula bone on one side. You're going to be doing both sides. And then once you get on that, you're going to then lift your butt up a little bit, and you're going to roll so that you're going up and down inside, and you can make circles. So right there's a hot spot for me. This is probably more painful than you even would know. You don't even know you have fibrosing here until you get on here with a ball, and you're saying, oh my goodness. But again, this is a good thing. People who have neck tension, headaches can be alleviated by this. So, spend your time, find your hot spots. Then you're going to come forward a little bit more, so you're going to roll the ball into it's the trapezius, the upper neck, lower neck, upper shoulder. And now you're going to go across the fibers there. And again, in my body, I have tons of knots in this area. So I'm just using the ball and trying to find those knots and then, rolling them. Okay, I got one right here. And if you were here in the room, you'd hear it clicking. And then you're going to take the ball out from underneath you, turn your head, and then use this to go across, using your hand, kind of not grabbing it necessarily, but you're kind of using the pressure of your palm and going across the neck muscles, the scalenes, the sternoclavicle muscle, and the cross fiber stretch. Like right there for me is a very sore spot. So I'm just spending some time going across the fibers, helping. It's like guitar strings. But you'll find that if you're doing this as hygiene on a daily basis, you will find that they get less and less rigid and less painful as you go. So finally, you're going to put this on the other side now, same thing. Inside the ridge of that, oh gee, there's a nice one, of the scapula bone, and kind of rolling up and down until you find the spots that you might need. And maybe you're one of these lucky people that you don't have any spots here. Good for you. Just move right on into the neck. So now I'm going to move on to the upper shoulder and the lower neck. I'm going across there. There's a nice knot. Okay, just trying to break some of this stuff up so that when I pick up weights, or if I go to my office and I'm sitting at my computer, I've already done some releasing so that I'm not so rigid and stiff, and I'm not going to potentially hurt myself if I'm doing the rest of my workout and these knots are there. So I'm releasing the myofibril bundling, if you will. And then finally taking it in the opposite hand with the palm and going across the fibers of the neck like you're playing a guitar with the ball, and just finding, your hot spots. Go right up to the back of the ear and then down right to the shoulder. And spending 20 seconds on those spots that are most sore for you. And then release. So what you should find when you do this is that there's a tingling in the area because you've enhanced some blood flow, you've helping to clear out some of the stuck metabolic waste that sometimes happens in these like fibrous, thickened areas. And then when you go to move, you should find two things. One, that there's a freedom of range in the motion of the movement that you didn't have before you did this. And sometimes people actually report that aches and pains that they were having were alleviated just from doing this and just getting the muscles to get a little bit more pliable. So this is my foam roller, tennis ball hygiene routine, and feel free to use this, play it over and over again, and use it on a daily basis.